want to also make sure we talk about our health as God's children. And so this podcast is dedicated in a way, and the name on it is Light of the World podcast. And today I want us to take time and have some health education. And we are going to be looking specifically at cervical cancer. But I'm so blessed to have two gentlemen with me who will introduce themselves to us so that you know who they are, and then we will have a discourse today. So let me begin with my brother. I hear your name and who you are, then I'll go to the other brother as well.
Okay, thank you very much, Papa. So my name is Godwin Ahomburu Akambom, a final year medical student, UDS.
Okay.
Yeah, my name is Erika Shite. I'm also a final year student, UDS.
Yeah.
That's right. That's right. We thank God for your lives. I don't take lightly when Christians get themselves educated, because sometimes you see people believe that being a Christian means don't get yourself into acquiring knowledge and all that. And we are blessed to have you. So today we want to share your expertise. We want you to bless us with knowledge about cervical cancer. So I don't know who is going to set the ball rolling, but I want to find out cervical cancer. The name sounds so beautiful. It's supposed to be in a register. What is cervical cancer? Godwin.
Okay, so basically, when we mention cervical cancer, we are dealing with two words. I just want to break it down so that the population that is watching us will understand. So the cervix is an organ that is only found in women. So you can't find the cervix in men.
Okay.
So when we mention cervical cancer, it means that we are dealing with cancer that pertains to women.
Okay.
And then cancer is just abnormal growth of cells. So at any point in time, some cells can go wrong. Naturally, God made the cells in a way that when they grow to a certain level, they go through death on its own, and then new cells will grow.
Okay.
But when something happens to it,
The cells grow and die.
they grow and die. We call it apoptosis in medicine. But should in case something goes wrong with that natural pattern, then you can have cervical cancer. So basically, cervical cancer is abnormal growth in the cervix.
Okay.
Abnormal growth in the cervix. Yeah, so basically, that's cervical cancer.
Wow, and this one too, like our previous podcast,
Yeah.
that one was prostate.
Okay.
It was gender bias. This one too is gender bias. So this one is for women.
Just for women, cervical
And men are
cancer.
discussing this topic.
Exactly.
It's interesting. So you have to appreciate us. It tells you how we care about women.
Yeah.
Dr. Eric, is there something you want to bring to bear about cervical cancer? Is there something you feel like you want to touch? What is it?
Okay, so Papa, thank you. And just as my brother said, it's an organ that is found in women, and the organ, it forms part of what we call uterus, or if you like, the womb.
Okay.
The womb of a woman is like a pear shape. You know the way the pear is.
Yeah.
When you take the pear, we have the bigger part and then the
Yes.
smaller portion.
Yes.
So that smaller portion is what can be likened to the cervix.
Okay.
So it's there so that when the woman gets pregnant, it will close it so the baby doesn't fall off through the vagina.
Okay.
So that's where the cancer affects. And so cervical cancer simply means, as he has beautifully explained,
That's right.
overgrowth of the cells
That's
of the
right.
cervix.
That's right. Let me give you a follow-up question. Why do you think it's so important for our audience to know about cervical cancer? Because the way you are talking about it and where it affects, very strategic position. So why do you think it's important for our audience to know about this?
So it's very important that our audience know this, because I believe a lot of people are in the dark when it comes to their health.
Okay.
And cervical cancer is very important that we get to know it, because it's when you take the cancers here in Ghana, when it comes to cancers of women, it's the second leading cause of cancer.
Wow.
Second only to breast cancer. So it's important that we talk about this so that they are educated, they know what they have to do, what not to do, and then our life expectancy will be increased.
Wow. So it is important we know, because looking at where you place it second to breast cancer.
Yes, please.
That is serious. Godwin.
Yeah, Papa.
So what do you think?
Yeah.
Why our people should know about this? I think it's scary from what Eric just said.
Yeah.
It's scary.
So adding up to the statistics my brother just said, when you take globally, it is the 4th most common cancer in women. And then in the year 2022, about 1,700 women died from cervical cancer.
Wow.
And so it's important we expose the public to know about this. Now, the thing about cervical cancer is that unlike breast cancer, you see the breast is exposed, so when you see something going wrong with your breast, you can easily see it. But the cervix is kind of hidden, and so you will need a speculum to actually see the cervix. You can't see it with your eyes. So usually when something is going wrong in the cervix, you may not know. And so getting a platform like this to expose some of these risk factors and some of these symptoms concerning cervical cancer is a good thing, because usually it's asymptomatic. Mostly when you have cervical cancer, you may not see some symptoms. And so when we do things like this, we just want to expose the public to know certain key things about cervical cancer, so that they'll be on guard. Yeah, so it's good we talk about cervical cancer.
Which means someone might have it and will not know.
Yeah, definitely.
Oh, okay.
Mostly,
Because
most
it
of the
doesn't
times.
come with kind of severe symptoms.
Yes, until it has gone bad.
Wow.
And so I believe that in the course of the program,
Okay.
we will be talking about.
I don't want to jump the cat.
Yes,
That's
yes,
very
yes.
powerful.
Thank you.
Eric, let me find out from you, how does cervical cancer occur? You know, I know in the beginning you touched some few things about the abnormal growth of cells and all that. So let's be very specific with this one. I'm living my life, then all of a sudden a woman begins to have all this thing. So what happens? And then this thing now begins to happen to somebody. I would be very happy if you can even let me know, if I have two people, why would someone get it and maybe another not, so that we can draw the line very well?
That you've asked a very important question, and addressing it, I would like to say that it's a cancer, so it means that it's a problem that has to do with your own cells. However, certain things can trigger it. We call these things risk factors.
Okay.
And one of the risk factors is having multiple sexual partners. So it is triggered by a virus which we call the HPV virus.
Okay.
And this HPV virus, you can get it when you have sexual intercourse.
Okay.
And once you have a sexual intercourse, the virus has affinity for attacking the cervix. And once it attacks the cervix, initially the body will fight it off, because God has made the body in such a way that it can fight off what we call it diseases.
Okay.
But when you get infected again, by going to have, that's why we are talking against multiple sexual partners.
Okay.
So when you get infected again, it puts a burden on the cervix, and then the cells of the cervix now start to change. So initially, the normal cervix that God created will now start changing, and the change usually we have something we call benign and cancerous.
Okay.
So they are all like swellings, but the benign swellings, they are localized, or they are limited to one space.
Okay.
And then the cancerous one, they travel from where they are to other places. So when this infection goes on, it will start by being a localized lesion or benign lesion. And usually, when we pick this early, we can prevent the progression.
Okay.
So it's very important that we talk about this, because how it happens is that if you're a woman and you're having multiple sexual partners, you are at risk of doing this thing. If you started having sex early, you are at risk of getting this thing. So stop, make sure that you are not having multiple sexual partners. If you are having sex, it should be protected sex, and you are on your way to guard yourself from
this is interesting that you didn't just add the scripture quotation to it. It would have been a sermon, because we have been talking about this every now and then, sexual promiscuity, having multiple sexual partners. So it looks like then Christianity is even helping people to stay out.
Exactly.
No wonder it is second on the list, because now I think sex is no more sacred.
Yeah.
People are just doing it anyhow. And you are telling me that that is one of the main risk factors.
Papa, let me even add that you may have one sexual partner, but if it's a high-risk sexual partner, then you are also endangered. So assuming you are my partner, you are my only partner, but you are engaging in other partners. It means that you put me at risk.
Yeah, indirectly.
Exactly.
Yes.
Yes.
I understand
Yes.
what you're talking about.
Yes.
Indirectly,
And so
that person is
I want to add that the HPV virus, the human papilloma virus, can affect men too. Actually, it is men that usually expose the women to the virus. So men can also have yes, yeah, exactly. So yes, that's very important. And he mentioned 2 of the risk factors. I want to add that smoking cigarettes is also a risk factor. So we want to educate people concerning smoking cigarettes. Also, giving birth to a number of children is also a risk factor. Yeah,
less or more.
More is a risk factor. There's a zone in between the cervix. We call it the transitional zone.
Okay.
So it is recorded that when you give birth more, that transitional zone is able to take some changes.
Okay.
Yes, and when that changes happen, it can expose you to cervical cancer.
Okay.
Also, early coitus, like you mentioned, having sex early can expose you to cervical cancer. Yeah, it is recorded that at around that time, your cervix epithelium is not well developed.
Okay.
And so if you engage in sex earlier than you should, then you'll be exposed to getting cervical cancer.
This is serious.
Yeah.
You know, it's one thing to hear about something and then to be educated like you are doing.
Yeah.
I'm even scared because this is something that is life-threatening.
Yeah.
In fact, I was going to ask about whether it is infectious or not, but I think that has already been answered, which means this is infectious.
So I like to add that, so the cancer is not infectious, but the prelude to the cancer is infectious. So the HPV virus is infectious. If a guy has it, he sleeps with you, you can have the HPV virus. Now, getting infected with the HPV doesn't necessarily mean that you are going to get cervical cancer. Because between 6 to 12 months, the HPV virus is able to clear on its own. However, if you are immunosuppressed or if there is continuous exposure to the HPV virus, then it may lead to cervical cancer. So it is recorded that 80% of cervical cancer cases is as a result of HPV virus infection. However, there are other risk factors that can cause cervical cancer, like we mentioned, the smoking, the alcohol, multiparity, early coitus, and all of that.
It's better to heed to some of this advice, which is going to take some risk from you, at least. Okay, bless your heart. I'm so happy to hear some of these things today. Let me go to Eric and find out the challenges that come with cervical cancer, with the symptoms. I was told earlier by Godwin that is what is symptomatic or something. I heard something like that.
Mostly symptomatic.
Unless it gets to.
So by the time you are seeing symptoms, then it means that the disease is getting bad.
Okay, so Eric, take me through when the thing has gone bad and what are some of the things we are to see.
All right. Yeah, so like you mentioned, when it goes bad, these are some of the things you see. So one of the characteristics of cancers is that they are very, let me say, they are aggressive, and not just aggressive, but they like to cheat. In that when they will form new blood vessels, which will be siphoning blood from you. And so one of the things that happen with cancers is that any least provocation, it will start bleeding, because they have a lot of blood vessels just to sustain them. They are very greedy. So if you have the cancer in the cervix and you're a woman, once you start having sex, the sex will be painful. So that's one of the symptoms. So any woman that is having sex, you are having sex and you are feeling pains, you should try and see the doctor. And then I mentioned that they like to have blood vessels, or they like to develop blood vessels. So after sex, you will see bleeding. So when you're a woman and you have sex and after the sex you see bleeding, there's the need for you to go and then you check on yourself. And if you, let's say you are menopausal, it means that you've stopped bleeding. But then all of a sudden you start seeing blood oozing out again, then it means that that's one of the signs and the symptoms. And also in the advanced stages, we said that the cancer can spread. When you look at the uterus, it's situated around where your ureter and then your anal sphincter is. So, and this sphincter is what controls your ability to decide to urinate or to defecate. And so when it spreads and they have issue on them, now that sphincter will be destroyed.
Okay.
And that decision where you decide that I want to urinate, it will be taken from you.
It will be taken away from you.
Yes. So when the urine comes, you can't control it. You will be voiding.
Oh.
And when the feces comes, you can't control it before you know you are bearing down. So it's not a pleasant.
That is
condition.
very disturbing.
Yes.
Very disturbing.
Yes.
Which means anywhere you are going in public, you are at risk.
Yeah.
You better maybe have to protect yourself.
Protect yourself, prevent it from even occurring in the first place.
And we are talking about cervical cancer, something that pertains to women.
Yeah.
Imagine a beautiful woman going through this. Is not something good to write home about. We pray that people listen to some of these things you are teaching,
Amen.
so that it will help them to. God will help me with the socioeconomic impact. How expensive it is to deal with cervical cancer, and what are some of the challenges you know when people get it? Some of the challenges they have with people around them and all that.
Thank you very much, Papa. Before I even go there, I just like to add that they may also have discharge issues. Yeah. So he did well by talking about the bleeding issues and also the surrounding structures. But women with cervical cancer will also have discharge issues like foul vaginal discharge. So when you begin to see foul vaginal discharge, don't be treating white, don't be treating chlamydia. See a doctor, let's do a proper investigation and tell you what's wrong with you. But on the question, socio-economic impact, it has a burden on the woman. It has a burden on her immediate family. It has a burden on her community. It has a burden nationally. You see, a woman going through cervical cancer will spend a lot of money treating it, especially when the stage is bad. And then at that point, you'll be weak, you can't be productive.
Wow.
Mind you, you have children who are also counting on you for daily bread, you know, assuming you're a single parent and you are taking care of your kids. All this is really going to be a tough one for your immediate family. And then also, you'll be staying out of work, especially if the disease is bad and you can't work. That's also affecting the country at large. So it's not a pleasant thing, but when we catch it early, there's hope. When we catch it early, it's good.
So this ailment is just going to make you incapacitated. You cannot do what you want to do.
Yeah. At some point, yeah.
Wow. Well, let's move on. Let's move on. Is it curable? Is it curable? I think with the presentation, it looks like early detection has been the mantra.
Yeah.
So if I detect it earlier, is it curable? If I detect it late, I want you to just let us know whether there is a window of hope somewhere. So let's talk about that, Eric.
All right, Papa. The good news is, as you mentioned, when we detect it early, there is a lot of treatment modalities that can be done to it to make sure it is cured. So the point that we want to drive home is the fact that it needs to be caught early. I mentioned earlier on that there are two stages to it. The stage that is localized, we call it the benign stage, and then the stage that is the cancerous or the malignant stage. So when we catch it at the benign stage, a lot of things can be done about it.
That's right.
There are surgical methods that can be done. There's chemotherapy that can be done. There is radiotherapy that can be done. And so there is hope for you, but you would have to come for us to screen and catch it early, and then you can be cured and you can continue having your normal life. And also, just to add to it, if you come early and the screening are done, there are things that can be done. I think we'll be looking at that more as the conversation goes on, which can even prevent the thing from starting in the first place. So there is good news for all of us.
Okay. For me not to, I think I just like what you brought up. So why don't you add a little about how to prevent it? And then I think Godwin will now have to add something to it. So just continue with it. So how do I prevent it? In the beginning, I was listening to you. I heard some things, some very powerful advice. but if you can reiterate, it's important when you repeat yourself. So how can one prevent it? And then, as you said, you added to it for us.
Wonderful. So, Papa, one of the way you can prevent it, there is the ABC to sexual transmitted diseases. The A is abstinence. We can't overemphasize it. And like Papa, you said, as Christians, it's something that we need to practice. So as our children are growing up, we are inculcating this in them so that they will grow up with it and they will know that abstinence is the best.
Abstinence
Yes,
is the best.
It's the best.
The ABC, abstinence. Let's leave the rest to Godwin.
Yeah, so he mentioned the abstinence. Yeah, the C, we talk about condom use. You should know that this is the consequence if I get into it, and then the use of condom. Now, the use of condom is actually one of the best things to do, should in case you can't abstain, because condom will prevent you from getting the infection,
And
and then it will prevent
in case you
unwanted
can't
pregnancy.
abstain, because of our I think our discussion is specialized.
Yeah,
As a believer, if you cannot abstain, you need help. You need,
Exactly.
Yeah, you need to submit yourself for help so that we can help you abstain.
exactly. Yeah.
Good.
No, I said that because you asked me to continue with the ABC,
Yes,
but of
yes,
course,
yes.
abstain until you are married. Then
right.
you are certified to do that. But to talk about, we were talking about prevention, right? Yeah. The key thing about prevention is screening. Is screening, because if you screen and we catch it early, you are safe. Now the truth is that this virus is very common in our society. It's very common in our society. So we say that if you are a lady and you have engaged in sex, exactly 3 years after, you should start screening.
Okay.
You should start screening for cervical cancer, because the exposure to cervical cancer is very high. It's a common thing, and it's around, so you need to screen. And so there are 3 screening modalities out there. They are actually not so expensive, not so invasive. We have the HPV DNA testing. We also have the pap smear, and then we can also visualize your cervix with acetic acid. So you just come around, we screen, and then we catch it early, and we're able to manage it. And then the most important thing is what we are doing now: education. Be informed. Don't take what we are saying here for granted, because you won't like the implications of cervical cancer. And so be informed. Know the symptoms, know the risk factors, and stay away from the risk factors. Smoking, don't smoke. Drinking, don't drink. Early coitus, as in early sex, don't engage in it. Multiple sexual partners, don't engage in it. And then to the men, I mean, if your wife gives birth to 3, it's not bad. But some of us want our wife to go ahead and give birth and give birth and give birth. You know, increased parity can also expose the woman to getting cervical cancer. And so the most important thing is what we are doing now, for you to have some form of health literacy, and then you screen.
Wow.
Yeah.
Bless your heart. I think the conversation keeps getting interesting every second by second. There is something I want us to do now. A take home. Anyone watching us today, and I don't know where you'll be watching us from, I want us to give them a take home. And I call it the most important single piece of advice you want to give to people. Number 1, those who already have it, and those who don't have it. And I want Eric to look straight into the camera and talk to somebody. What single advice do you want to give to people all over the world about cervical cancer?
All right, one advice that I'll give, I think I'll start from the bracket of people that don't have it. The single most important advice I'll give you is that go and get screened. After getting screened, there is a vaccine. Because it's a virus, we've designed a vaccine. Once you take this vaccine, it will prevent the infection from happening, which will lead to the cervical cancer. And this vaccine, it is administered to girls between the ages of 9 and 14. And so if you are a mother and you are listening to me and you know your child hasn't started having sex yet, go let the child be screened and vaccinated. The vaccine is available in Ghana. In fact, it started rolling out this September 2025, and so there is hope for it. So that's one of the most important advice I will give to those that don't have it yet. Get screened and then you will be vaccinated. The other advice I will give to those that have it, I think my brother will talk a lot about that, but I want to look at the brackets of people that are normally neglected, and that is those that have the advanced form of the condition. For them, it looks like the health sector has done all that it could, and there is nothing the health sector can do again. So all that they are trying to do is to manage your pain so that you die peacefully, and that is when people tend to shun them. And so I'm not just talking to them, but I'm talking to the people around them. This is the time that they need you the most. This is the time that you must be there for them, and this is the time that you must pray for them. And the prayer is very important because it brings my mind to one quotation in the Bible. Daddy, you asked that I should mention one quotation. Yes. So there's a quotation in the Bible. It's about the woman with the issue of blood. Okay. For 12 years. He has traveled from physician to physician. Yes. She had no answer until she met Jesus Christ. So even if the physicians or we the physicians are saying this is all we can do, with prayers the Lord can come through. And I believe that the disease that we've given up on, Jesus Christ can heal you and heal you completely.
My goodness, that's an icing on the cake. Beautiful, bless your heart. Godwin, your final word, a take home to our viewers. I want you to look into the camera and talk to them.
Yeah, I can't overemphasize on the subject of screening, because screening is very important to me. Now, if you're a woman out there and you know that you have engaged in sex, or probably you have sex with your husband, or you're exposed to sex, it means that you should be screening all the time. I always say that the way women like to change their wardrobe, they should also understand that there's something going on wrong in there which they can see with their eyes. And so when they come to us for screening, we will look at it and then we will tell them what is going on. Now, if you have the disease, it's not a death sentence. Cervical cancer can be treated, cured, and managed very well, unless it has gone bad. And even if it has gone bad, we can manage your pain so that you can go peacefully. And then I like to add to what my brother said. In our days, we can say that the woman that suffered the issue of blood probably has cervical cancer, because abnormal uterine bleed is one major symptom of cervical cancer. And so prayer can salvage the situation. Believe in God, have faith, and God will heal you.
Wow, that's a beautiful submission right there. Godwin and Eric, I would like to say God bless you.
Thank you, Papa,
for sharing your knowledge with us. Someone said that the best place to store your money or to invest your money is in your brain. It's never said anywhere that thieves enter somebody's mind and took their knowledge. Yes, it's good to educate us. And so, people of God, I want to say to you that a lot has been said. We want to believe that everyone who watches this podcast, so far as you are a woman, you are delivered.
Amen.
If you don't have it, you are not going in for it. If you have it, the management and all the protocols have been outlined for you. And I believe you are going to be okay. Again, if you have a challenge and you think you want to know more, you can leave a comment, you can write something. Just we'll give you a lot of avenues you can contact us, and I'll lead you to this wonderful gentleman, and they can help you with one-on-one kind of stuff. So God bless you for tuning in, and we will meet you again with other important lessons. Gentlemen, I want to say